Welcome back to The Other Side. We're talking to people who feel they've found healing through the power of hypnosis when conventional medicine has failed. In Janine Weiss's case, over a half dozen different doctors could not tell her what was causing her paralysis. Well, Stephanie Jordan is the hypnotherapist who helped solve Janine's problem with her paralysis. Janine, thanks for joining us. Tell us what happened to you.
Well, about 2.5 years ago, I was working at a very fine job. I was very happy. I thought my life was going just perfectly well. And somewhere one time in the middle of the night, my legs started tingling. You know, I started going like this, thinking it was poor circulation or falling asleep. And it was a tingling sensation, went up my entire right side. And you could have literally cut my body in half. And it got to the point where it went into my arm, and I couldn't move my hand.
Pretty frightening.
Oh, it was terribly frightening. I didn't know what it was. I really thought maybe it was just stress or nerves. So I went to the doctor. Turned out to be ultimately 7 doctors and $7,000. And the last diagnosis the doctor said to me before I left his office for good was, you know, I think you have MS. And I'm sorry, there's nothing we can do. So I went to an acupuncturist. Somebody suggested that because I thought maybe it's nerves. And the acupuncturist suggested I see a hypnotherapist. After, I think just a couple sessions, we got into doing what we refer to as body work. And we literally had dialogues and discussions with the pain and the paralysis.
While under hypnosis, in other words.
Yes. Mm-hmm. The pains went away. I mean, I don't have them anymore. That's 2.5 years ago.
Stephanie Jordan has used hypnotherapy in dramatic ways in her own life. Thank you for joining us. Now, tell us the story about the finger. This is amazing to me.
This was a turning point in my life, kind of a test of faith. I had grown up with hypnosis. My mother's a hypnotherapist. I'd practiced visualization my whole life. I brought my teeth together when I was 9 years old instead of having to have braces. But
you brought your teeth together with hypnosis?
You want this story or the finger story? Yeah.
No, let's go right to the finger story, but it's amazing. You brought your teeth together with hypnosis.
Well, there wasn't money for braces, so they said, you're just going to have to think them together. So every night I'd think them together. And
I could see parents all over the country with their kids. They look at the watch. There you go. Bring your teeth together. Okay, go ahead.
So I was in my early 20s. I wasn't yet a practicing hypnotherapist, but I was very familiar with all of the techniques. So I had a job in advertising at the time for an insurance company where doctors worked, and yet I was terrified of anything medical because I'd never had anything happen to me. So I was preparing some artwork with a utility knife, and I cut off the end of my finger. And there's blood everywhere, and I'm like, oh my gosh, they're going to send me to the hospital. And I had never experienced anything like that. So I throw the evidence away. I mean, I don't recommend this now.
You threw away the tip of your finger?
Did, and I grabbed a hunk of Kleenex and I put it there and I taped it up and I thought, no. I was very young. Okay, so anyway.
It's just an interesting reaction that you cut your finger with a knife and your first reaction is get rid of the evidence and throw the finger away. So go ahead, so you wrap it in a Kleenex.
And I could do this for you too.
Yeah.
So anyway, I hurried home and I was in a panic, but I didn't want to go to the hospital. So I came to this profession through fear. And I called a friend, and she said, you know, you can hire a nurse to come to your home. It's part of the Christian Science Church, and you won't have to look at it, and she won't look at it, and you can just hold that image that you say that you're working with your finger, and you could do that. And it's like they won't tell on you. And so I did that. So this woman would come every day and change the dressing, and all I would do is just visualize my finger complete and whole. And it took about 6 weeks. And now at work, they're flipping out because, as I said, I worked with MDs.
And you grew a hunk of your finger back.
I grew it back.
Let's see.
This finger.
Which one is it?
This one, thank goodness.
This one is? Yeah, no scar or anything.
No scar.
Pretty perfect finger. Might it have been longer? Hold this up. Was it longer?
There. Yeah.
That's incredible.
Yeah, I don't know if I could do it today because I had absolute faith. Now I work with doctors, so I lost our faith.
Well, we have some tape that shows a part of a hypnotherapy session that Stephanie conducted for a woman with severe back pain. Oh, look at this.
With each movement of your fingers, your hands being pulled closer and closer to your face. And the eyelid fluttering is just a natural part of hypnosis. And allow your fingertips to touch your forehead. And when they do, you'll be in deep state of hypnosis. Just allow your inner awareness to slowly move down your back and nod your head when you're aware of the exact location of your pain that you experienced when you came in today. And just allow the resonation to penetrate deeply into your mind, taking you into a wonderfully restful, calming place of healing.
What was going on there? Explain that session.
That was a hypnotic induction using eye fascination. The eyes will tire very quickly if they're asked to stay focused because the natural activity of eyes is to dart and leap. And so the muscles around the eyes fatigued rather quickly. And then I did a little bit of shock therapy as I touched her forehead, that little slap, and snapped my fingers. Mm-hmm. And then because it's very hard to resist sound as a deepening method, I played some Tibetan bowls and a Tibetan bell.
It was very, even just listening to it, sounded very enticing.
Isn't it? Yes.
I almost went under myself, yeah. You used hypnosis when the doctors told you couldn't have children. Tell us about this.
Yes, I had some surgery performed. It was necessary surgery to my cervix. And something went wrong. A bulb burned out. Lighting. It was done as an outpatient. And there was just a doctor in the room. He swore at the time. I knew something was wrong. And it was cryosurgery. And so the nitrous oxide was left on too long. Severe scarring. Scarred the whole cervix deeply. Mm. And so I overheard them saying, she's not going to be able to conceive. And so then I questioned it, and then I went for further exam and said, that's correct, probably not. And I was terrified, horrified, and then I thought, wait a minute, I help people with this, I can help myself with this.
I grew a finger.
Like that. Exactly. So I thought, okay, here's a test and an opportunity to...
And kidding aside, let me interject, but the point seriously is that it's a confidence that the mind can do things that otherwise logic would say it can't.
Yes.
So you applied this once again.
I let go of the fear that it wasn't possible, and I did a dialogue, as Janine did, with my cervix and asked it what it needed to let go of the scar tissue, and it had me imagine myself little going in there and sanding the scar tissue off.
Can we see the results of your hypnosis? We'd like
absolutely.
To see the results.
Would you like to see the results?
Of this, here they
shy
come.
results.
This is Dad with two little squirts. Well, there you are. Little hypno babies.
2 results, yes.
Now, will you teach them hypnotic techniques to use in their own life?
Well, I'm keeping a journal of every time I traumatize them, so later we can go back.
You can go back and say,
release it all.
I have a note here about September 18th. That's right,
so
when you
sorry,
were 2.
But we'll take care of it.